fractional CO2, but I'll tell you something. The density that I set this to is about 80%, which is very high overlap, meaning most people wouldn't be doing this unless you're super light skinned or very severe scars. Turn all the way this way. You can see, remember I told you that the deep laser takes time. I'm gonna start on your chin. Takes time for the swelling to come, and you can see it now starting because that deep swelling is occurring. She's really numbed with nerve blocks, but there's always still some degree of pain. I just want you guys to know, though, she's doing really well. Because everyone gets so nervous for my patients. Okay, and we're working our way down in a very controlled pattern. Each of these little dots are basically the skin dying. It's basically water that's being attracted by the laser, and then it's dehydrating the skin cells. And those skin cells that get dehydrated will peel off as scabs and be replaced. Little pinch right your lip, good. Be replaced.
Oh.
It's okay, you're doing good now. Sorry, some of the area close to your nose is a little sensitive.
It's okay.
Just a few spots here and there. Those dehydrated cells will peel off and be replaced with new skin. What I suspect is that at about a week, most of this will peel off and she'll look kind of pink like she is right now. And then for another week or two, it'll be blotchy pink. And then after that, the next few months, it'll slowly heal. My goal would be if we could get her back in 2 to 3 months to do a non-ablative laser to complement the ablative what we're doing now. But let's see how much improvement she gets. If she's happy.
So that's protein, right? The white dots?
Say that again.
The white dots are protein?
What?
Are the white dots protein?
No. These are dead skin cells. But yes, they call it protein denaturation in the cell. But those are actually skin cells. So you see how some areas she has little sensitivity, more close when you go to the nose?
Why is that?
Just the nerves, they're not, they don't cover every area completely. So we do the best we can if we're gonna keep someone awake. She's doing really well with some medicines.
How many passes are you doing?
What?
How many passes are you gonna do?
We're doing one very strong, we already did a deep layer, right? We've already done 2 passes with other devices. Sorry, honey, this is a little more sensitive by your eye. We've already done 2 passes with other lasers. With the superficial laser, we're doing a high overlap and a high density.
S.A. Mahaffey says, "Hi Ella, this is Mom. Love you."
Who? Is your mom?
S.A.
Oh my
Mahaffey.
God, that's so cute. Hi, Mom. We're taking good care of her, I promise. She's like my sister now.
Aww.
So we did very strong here, deep, remember. So you don't want to go too much and overlap here. It will take too long for her to heal. Okay, turn this way now all the way. So she's already 3/4 done, you guys. You can see how improved she is. The feathering here. Around the eye is a little more sensitivity because there's no direct nerve here. We do some local injection, but it's very quick to get through. She's doing really good. She was very nervous, and for my patients that are younger, who have never done treatment before, or who have done treatments and have been, had bad results, they get really nervous. So it's very hard to trust someone. This is why I want you to go to somebody who's good. I'm not saying everyone can go to me, but I want you to find somebody that you trust, that does care about your results. Do the best you can to try and find that, or take your time and spend a weekend here.
Fun to you.
Come to me, exactly.
They should.
I would love for them to. You're doing great.
Thanks.
So you see how we're talking, she feels fine. There's just small areas. We're really, really concentrating on about a 30 to 50% overlap. But remember, this is about an 80% density. So you don't want to go too aggressive. What's great is she's younger. Younger skin heals like baby skin. Babies can get burned and get scarred and are much easier to treat and clear up scars than older patients. Because collagen does a remodel as well, and your stem cells are changing after you hit puberty. So right now she's perfect timing, actually. Now again, there's that dewdrops on a rose petal. You see that, the glistening? Okay, stay right there. Perfect. That's the deep swelling from the deep laser.
Can you use cream sweat after?
Oh yeah, we're gonna put on PRP, which is growth factor. We're also gonna put hyaluronic acid and vitamin B. Doing great. It's just the final part, okay?
Yeah.
As we get closer to your nose. And then she has a very explicit aftercare protocol that she's gonna do, and we'll have her send us videos and pictures every day because I know what's gonna happen. Everybody's gonna stay right there. That's perfect. Everyone's gonna ask all about you. I already know.
Woohoo!
They're gonna love to see how you do.
Like, you should go outside like normal, like no big deal.
No, I mean, there's a big deal. You don't want to be directly in the sun. So as long as she has a hat and skincare, sun protection, I'm fine with it. She just has to be really cautious about her skin being sensitive over these next few weeks to months. Okay, don't move for 1 second, okay? I know this is sensitive here. Just bear with me. Perfect. Okay, good. I'm going to do above your lips. Stay calm. There's a couple treatments, literally just a few. There we go. Good. Basically done. Just fine tune everything. I'm gonna blend the edge. Okay, look all the way this way for me. Perfect. I'm gonna blend the edge, you guys. We call this feathering. I know, it's a little more sensitive there. Okay, now turn the opposite way. Beautiful. Feathering. Okay, and then lastly, just gonna go over her nose. These are very small ones, just stay still, okay? These are very small. This she doesn't need aggressively here, although I'm still gonna do it at the same setting because it'll blend everything better.
Sorry, I just joined. I just missed it. What's the name of this and what's the purpose
So
of
this is the
treatment?
CO2 laser for acne scars in my patient. She also did have a combination of things, more than the CO2, but if you're just tuning, that's what we're primary focus is right now. We also did subcision and filler.
Woo!
Sorry, honey.
Oh, you're good.
You're almost. This is the last part. You're literally done. We also did some subcision and filler on her cheek area to help with some of the deeper, broad scars. And we also did microneedling radiofrequency to break apart scar tissue and also tighten everything long term. All right, last part. Nose is sensitive. Good. All right, you guys. Now let's put on, that's it. Good. All right, deep breaths. Now we're gonna put on the PRP. Hold still. Okay.
Ooh, sorry.
Go ahead, lift. No, you're fine. Go ahead, lift. Now we're gonna apply, you guys could see this is her growth factors. This is PRP, which we drew from her blood. We wanna get that on immediately. Now look, if you take a look, all these little dots, we don't wanna wipe them too hard because I don't want them to move. In the old days, we used to do what was called de-charring, where we would scrape all this off. Now I did do that recently on a couple of my patients for deep wrinkles and for aggressive nose treatment when they have very thick noses, like rhinophyma. But on you, we want to keep those because we want them to act as a protective barrier. Sorry, I want to blow in your ear.
Oh, we're good.
Protective barrier to help the new cells rebuild. So we don't want to wipe those all off. I want to be really gentle.
Dave from Canada wants to know if this is painful.
Why don't you tell him? You tell him. What do you think? How bad was the whole overall 1 to 10 with the nerve blocks and everything? How did you do?
Good. I mean, the last one was like a little
More sensitive.
Yeah, the
That's
other
normal.
stuff. I cannot talk.
That's okay.
The other stuff was
okay.
super fun.
So out of a 1 to 10, even with the nerve blocks, what would you say? A 5, a 4?
like 4.5.
Okay, well that's not
It's not
bad.
terrible.
So you don't need anesthesia for that. And that's what's
exactly.
good. You don't have to take all those medications that could harm you. It shouldn't be more swollen and everything.
Now, those that just watched the entire procedure, did you do this in one day?
Oh yeah, we did this all at once, guys. I didn't go home. We're here. We're in it together. This is running a marathon.
And Jaclatica said, hearts,
Who?
my doctor.
Love you. I don't know who that is, but I love you. So this is going to make her feel really good, actually, because this is very cold. Now, she can't feel all this because you have nerve blocks, but...
Smells good.
It does.
Now, what is this?
So this is our protective healing mask. Some of these are made of biocellulose polymers. Some of them are made with hyaluronic acid. There is a little bit of gel. Is it? You have the gel in that bag. There's a little bit of gel in that bag. We're gonna pour
What you
it
did
out.
today, can it be used for the back, the procedure?
Well, yeah, if you have acne scars, sure. It's just maybe too big of an area. So we're gonna put a bunch of hyaluronic gel
Okay.
on here right now, so you're gonna feel real moist, okay?
Okay, cool. Thanks.
Perfect. We're gonna get that all on here, get her real moist, and then we're gonna put her under a red light and help her heal, and we're gonna keep her safe from corona and safe from infection over this next week because she's gonna social distance,
Yes, I am.
which will be great. And
Where are you located?
We're located in Los Angeles, guys, West Hollywood. You guys know, follow us, JasonEmerMD.com. We'll do a little testimonial in a short time period, and we'll show up throughout the rest of the week. You can follow her full transition, but the goal is let's look at her in 3 to 6 months, because now we've started that long-term treatment plan. It's like the workout for her skin. We're gonna rebuild that collagen and remodel it so she gets a really good result. Bye, guys.
Thank you so much.
Oh, you did so good.